Hello, everyone, and welcome to the discussion on this topic Drugs and Cosmetics Act 1940, Rules 1945. Upon completion of this chapter, students shall know what are the provisions of Drugs and Cosmetics Act 1940 under which drug inspectors can be appointed, what are the powers of these drug inspectors, how they exercise their powers, the schedules to this Act Drugs and Cosmetics 1940 and the schedule to the rules of the Act 1945. So first of all, let us see who are drug inspectors and why are they appointed. The Drugs and Cosmetics Act 1940 was drafted for regulating the guidelines for manufacture, sale and distribution of drugs within Indian subcontinent. It is applicable to all the states of India including Jammu and Kashmir. The central and the state government may ensure that all the guidelines have been followed by the manufacturing premises and all the wholesale shops and chemists and druggists. To ensure this, they appoint the drug inspectors. The central government or the state government may, by notification in the official gazette, appoint such a person as it thinks fit, having the prescribed qualification to be inspectors for such areas as may be assigned to them by the central government or the state government as the case may be. The powers which may be exercised by an inspector and duties which may be performed by an inspector, the drugs or classes of drugs and cosmetics in relation to which the conditions, limitations, restrictions subject to which powers and duties may be performed shall be prescribed. To inspect the premises and manufacturing which manufactures biologicals and other than biologicals, the drug inspectors are appointed. The minimum qualification for being appointed as a drug inspector is a degree in pharmacy or pharmaceutical chemistry or pharmaceutical science, or diploma of institution of chemists, or a degree in medicine, clinical pharmacology, or microbiology. No person having any financial interest in the import, manufacture, or sale of drugs and cosmetics shall be appointed as an inspector under this section. Every inspector may be deemed to be a public servant within the meaning of the section 21 of the Indian Penal Code 45 of 180. Powers of Inspector. Subject to the provisions of section 23 and any rules made by the central government in this behalf, an inspector may, within local limits of the area for which he is appointed, inspect any premise wherein any drugs and cosmetic is being manufactured and the means employed for stand arising and testing the drugs or cosmetics. Any premise wherein any drug or cosmetic is being sold or stocked or exhibited or offered for sale or distributed. Take any sample of any drug or cosmetic which is being manufactured, sold, stocked, or being exhibited or offered for sale or is being distributed. Take any samples from any person who is in the course of conveying these samples. So these are the powers of an inspector. They can inspect any premise where either a drug is being manufactured or they are being tested, or any means, equipment, instrument have been kept in those premises which are being used to manufacture drugs which are licensed for distribution within Indian subcontinent, within the area for which he has been appointed, he can he or she can take samples of any drug and cosmetic which is being stocked, sold, or being exhibited for distribution in a chemist shop, and take samples from any person who is in the total cycle in between the course of conveying of the samples. At all reasonable times, he or she, with assistance if he requires, search any person who he has reason to believe has secreted about his person any drug or cosmetic in respect to which an offense has been committed. Enter and search any place for which he has reason to believe that offense has been or is being committed. They can also stop and search any vehicle which he feels has reason to believe is conveying drugs and cosmetics which is being, as an offense, they are adulterated, spurious, or misbranded. The other powers of inspector includes he can issue an order in writing to a person in possession of drugs and cosmetics which for which an offense has been or is being committed, and seize the stock or any article by means of which an offense has been committed, examine any record, register, document, or any other material object which may furnish evidence of commission of offense, require any person to produce a record, register, document for manufacture, sale, distribution, stock, exhibition for sale, in respect for which he has reason to believe an offense has been created. The powers of an inspector as per is also includes the following. As per the provisions of the Code of Criminal Procedure 1973, shall, as far as this Code of Criminal Procedure applies, in a similar way, inspector can also search any manufacturing premise in the same way as an authority for a warrant allows, as per Code of Criminal Procedure 1973. Every record or register that or document that a drug inspector seizes, he or she shall take all the copies, and thereafter those records shall be returned to that person within a period of 20 days. If any person wilfully obstructs an inspector in the exercise of the powers conferred upon the inspector, then or refuse to produce any record, he or she are liable for punishment with imprisonment up to 3 years or fine and imprisonment both. How does an inspector exercise his powers? These are the procedures. Where an inspector takes a sample under this chapter, shall tender a fair price thereof, and may require a written acknowledgment. Where the price tendered is refused, he shall tender a receipt in prescribed form. Where an inspector takes a sample for the purpose of testing and analysis, shall intimate such a purpose in writing to the person from whom he takes the sample. The inspector divides the sample into 4 parts, seals them, and adds his own seal to each portion that he has packed. Out of the 4 parts, one part he may give it back to the person from whom, or the chemist or retailer from whom he has taken the sample, or the manufacturer from whom he has taken the sample. The second part, he has to send it to the manufacturer details that is mentioned under section 18A. The third part has to be produced in the court before the judicial magistrate during the proceedings, and the fourth part is to be retained with himself. The one portion which has to be sent to government analyst for an analysis has to be recorded, and it also has to be informed adequately to the person from whom he is taking the sample. If ascertained that the sample does not contravene any of the provisions as per this guideline, then the inspector can revoke the orders passed or return the stock. If alleged contravention be such that defect may be remedied by the possessor of the drug or cosmetics, on being satisfied that the defect has been remedied, revoke his order. There are two schedules to Drugs and Cosmetics Act 1940. The first schedule deals with the names of the books under the Ayurvedic and Siddha systems. The second schedule deals with standards to be complied with by imported drugs and drugs manufactured for sale or distribution in India. As per the provisions of this Act, any drug which belongs to an Ayurvedic or Siddha system of medicine should be manufactured as per the formula mentioned in these books, which are mentioned in the first schedule to the Act of Drugs and Cosmetics 1940. The second schedule details the standards to be complied with for import, manufacture, sale, or distribution. As per the second schedule, and there are schedules to the rules as well. These are the schedules to the Act, first and the second schedule. These are the schedules to the rules. There are several schedules to the rules, which can be enumerated as Schedule A, which is meant for applications for licenses for import, manufacture, and sale of drugs and cosmetics, the forms in which the licenses are granted and renewed in other forms. Schedule B, fees for analysis of these samples to be paid to the central drug laboratories. Schedule C is the list of biologicals and immunological products, antibiotics, ophthalmics, ointments, and all other products for parenteral use. Schedule C1 is a list of drugs from biological origin, namely alkaloids, hormones, vitamins, antibiotics for oral use. Schedule D is exemptions that have been granted to drugs and importers of drugs from complying with requirements of import of drugs and also the conditions for such exemptions. Schedule E has been deleted. Schedule E1 is a list of poisonous substances under Ayurvedic, Siddha, and Unani systems. Schedule F is special provisions to be complied with for the manufacture, testing, and labeling of biological products for human use, like sera and vaccines. These provisions have now been deleted. The requirements for running blood banks and other requirements are now included in this Schedule F. Schedule F1 deals with special provisions to be complied for the manufacture, testing, and labeling of veterinary biological products. Schedule F2 lays down the standards for surgical dressings. Schedule F3 lays down the standards for umbilical tapes. Schedule FF lays down additional standards for ophthalmic preparation. Schedule G is very important. Most of us have seen this in the labels of the drugs. These are the list of drugs which should be used by patient under medical supervision and which shall be labeled with the caution It is dangerous to take this preparation except under medical supervision. This is what is mentioned in red at the place left side corner of the label. If we see a primary label of the drug product, we will see at the left hand corner in red it is written RX, that means it's a prescription drug, and also this caution or warning is mentioned that it is dangerous to take this preparation except under medical supervision. All the hormonal preparations comes under Schedule G drugs. Insulin also is a Schedule G drug. Schedule H drug, they are again the list of drugs which are to be sold by retail against prescription of a registered medical practitioner only. Again, the label contains a warning that it needs to be sold by retail on prescription of a registered medical practitioner only. All the lifestyle drugs like antihypertensives, atenolol, amlodipine, sotalol, and all the antidiabetic drugs like glimepiride, all of them come under Schedule H. Schedule I is the list of poisons of particulars about the proportion of poison in certain cases. However, now after Schedule E, which was deleted in 1982, Schedule I has also been deleted. Schedule J details the names of the diseases and ailments which a drug may not purpose to prevent or cure by means of claims made on the label of the container of the drug. That means these are those diseases which a drug should not claim to cure. They are AIDS, cancer, baldness, fairness of skin. Uh, there are several other diseases like hydrocele, hernia, angina pectoris. There are many other drug diseases to this Schedule J. There are a long list of diseases which a drug product should not claim to cure. Schedule K, this is the names of drugs or classes of drugs which is exempted from complying with provisions of manufacture, sale and standards of drugs and conditions of such exemptions. These are certain drugs, homeopathic drugs or certain homeopathic drug preparations are under Schedule K. Schedule L, they are the list of drugs which required to be sold by retail against the prescription of a registered medical practitioner. Subsequently, the drugs listed in Schedule H were transferred to Schedule H. So now L was deleted in 1982 because all the drug products which were mentioned under Schedule L were collated, compiled along with Schedule H. Schedule M is good manufacturing practices and requirements of premises, plant and equipments for manufacture of drugs. Schedule M1 is the requirements for factory premises for manufacture of homeopathic medicines. M2 is the requirements for factory premises for cosmetic manufacture, and M3 is the requirement of factory premises for the manufacture of medical devices. Schedule N lists down the minimum equipments, requirements of premises for effective running of a pharmacy. Schedule O lists down the standards for disinfectant fluids. Schedule P is the life period and the conditions of storage of drugs, which we can also see at the back side of the label of each and every drug product. Schedule P1 is the pack sizes of drugs. Schedule Q is the list of coal tar color permitted to be used in cosmetics. Schedule Q1 is the use of permitted colors in soap. Schedule R is the standards and labeling requirements for condoms, copper-T and contraceptive tube rings. Schedule R1 standards to be complied by medical devices. Schedule S is the standards for cosmetics. Schedule T requirements of factory premises and hygienic conditions to be complied with by the manufacturer of Ayurveda, Siddha and Unani drugs. Schedule U details the particulars to be shown in manufacturing records, raw material records, and in analytical records of drugs. Schedule U1 particulars to be shown in the manufacture records, records of raw materials, and in analytical records of cosmetics. Schedule V standards for patient and proprietary medicines and maximum and minimum quantities of vitamins that are permitted to be added in such preparations for oral use. Schedule W names of drugs which shall be marketed under generic names only. Example aspirin, analgin. These are the drugs which needs to be manufactured under generic names only. Ferrous sulfate, another example of Schedule W drug. Schedule X names of psychotropic drugs for which special control measures have been laid down. These are narcotic and psychotropic substances. They need a special way of handling because if they are prescription drugs and they should not be given to any person without a prescription. Also, the chemist and the druggist should maintain a separate register record of each and every tablet being sold. A separate register has to be maintained. They are controlled substances even for the manufacture of new drugs which belong to Schedule X. Special licensing procedures are required. Schedule Y lays down the requirements and guidelines on clinical trial for import and manufacture of new drugs. That means any drugs which need to be used for clinical trials in Indian subcontinent, they are either whether they are imported or whether they are manufactured within India for clinical trial, all the requirements have been mentioned in Schedule Y. So now this brings us to the end of this discussion of the topic we today. Thank you.